All right, let's get started. Good morning, everyone. I'm Larry Boris, the Executive Director of the National Association for Workplace Healthcare. Thank you for joining me on this first Monday roundtable. Hope everyone is safe and warm where you're at. And I think today we're going to give you more information to let you expand your activities or perhaps have a better insight into what measurement and performance actually are all about. So this is a program that we have every month. We have two webinars. This first one is on, as I said, measurement. For those who may not be familiar with NAWHC, formerly called the National Association of Worksite Health Centers, we're a nonprofit membership organization supporting unions, employers, health providers, healthcare vendors who are involved in on-site, near-site, mobile, virtual health centers, and other direct contracting for medical services. We are a Switzerland of an organization representing both the purchasers and the providers in this, and we offer a variety of educational programs, networking, benchmarking, resources. So if you've not participated in us before, please take a look at the website, nawhc.org. These are some of the other programs that are upcoming and this year. Each Monday we'll have a different title, and again, either the Wednesday or Thursday of the month we'll typically have something. All of our programs, other than the in-person ones, are recorded, and you'll get copies of both the recordings and the slides if you would like that as well, as a member of the organization. So we particularly want to point out our annual forum, April 8th and 9th in St. Louis. Hopefully you can come down and we can all meet in person. So Roundtable is a little bit different than our webinars, in that what I'd like to do is just kind of go around the table, just identify your name and organization title, maybe your responsibilities. Then I'll do a presentation for about 30, 35 minutes. And then I'm going to go around the table and ask everyone to give me your perspectives, your experience, your knowledge on the topic of measurement, so that we can have some real sharing here. As I said, this will be recorded and be shared with everyone. So if there's something proprietary you don't want to share, then probably don't say it. Or we'll blank it out or cut it out or something. We'll try to do the best we can. But we hope you'll enjoy this and be able to take something back the same day. Again, for those who may not be familiar with our organization, we have a wide variety, all industries, all sizes of employers. I think our smallest is 200. Our largest probably has somebody in every zip code in this country. So you don't have to be a large employer necessarily to have a worksite center. And providers of all sizes are supporting the centers. We have health systems, we have individual hospitals, medical groups, and we have single physicians who provide care as well. At any rate, let's start at the very beginning. So, why do you want to measure? You want to measure for a variety of reasons. The bottom line is, what's the value? Are we getting value from the investment in finances and time and staff that we're putting into this health benefit? Because that's what this is. This is a health benefit option that employers are offering. So you want to find out, are you meeting your objectives? Do you have problems? And if you have problems, where do they exist? Are you meeting the employee needs of access, of better care, of lower costs? Are you saving costs? Do you need to save costs? Do you have unnecessary care? Do you have inappropriate care? Do you have most of your people going to emergency departments, which is the highest setting in the healthcare industry? Is the entity that is managing your center, almost 70% of all worksite centers are run by a third-party vendor, and about 20% by a hospital and health system. Are they performing? Are they meeting the performance guarantees? Are they meeting your objectives? And ultimately, at the end of the day, can you get the resources you need from the C-suite or the CFO? Do you have the data information that will support you, showing that this benefit is really providing value to the organization? So among the employers that I've worked with over the years, these are the many of the areas that they're focusing in on. Some of them may want to cover all of these areas: financial, wellness, recruitment, retention, and others just one. Just how do I manage costs? How do I lower costs? And so the bottom line here is, if regardless of whether you've got 1 or 12 different objectives, how do you know that your center is meeting them? If you don't develop metrics at the time you develop the center objectives, then you're just throwing money out the window. You really have to be able to prove that you're achieving or you're getting somewhere. So these are some of the things that you might want to question. Uh, are you, again, meeting your objectives? What were the problems? Where are you having to address these areas? You want to know what things perhaps your client partner has raised. Uh, do you know what the employees are asking about? Are you asking employees what they think of the center? Are you getting their experiences and stuff? You really have to figure out all of these kinds of areas. And at the end of the day, again, you want to find out, are you doing it the way you need to do it and getting the data that you need to get? So what unfortunately we find is many employers, they've carved out their health benefits and they've got a smoking cessation program and they've got an obesity program and a diabetes program and a EAP and they've got a PBM and they've carved out all of their data to different vendors and they have a worksite center, but they don't feed that information, that data, those visits uh, into the center. They don't perhaps even allow their worksite center manager to receive data feeds from the health plan or their PBM. And so they really don't know all the things that are going on, where all the money is spent, all the services are being spent. So what we're finding is that a large number of employers in our surveys, they don't even integrate. And so there's no really way to know if you're getting the total population health that you really need to do. And unfortunately, and this relies not just for health centers, but also for health benefit programs. I used to lead the Midwest Business Group on Health in Chicago, a large business coalition of multi-state global companies. And we found out that about 25% of them never measure their health benefit programs. And clearly, if you don't know your ROI, if you can't gather that data, then again, how do you support offering any other programs or getting increased resources? So measurement is really key. And the recommendation that we have at NOWIC is to really take what we call the VOI approach or the value of the investment. So it's much more than are we getting our return on capital, but what are the other areas that really bring value back to the employer? Are we giving increased access to care? Are we recovering some of the costs? Are we engaging people in the other benefit programs? When employers can offer a variety of programs, and many times only 20-25% of the people are really engaged. So does the center increase engagement? Does it help people, more people get their flu vaccinations? Are you reducing the number of people going to the emergency room for non-emergency conditions? Are you increasing those people taking biometric screenings? Are you reducing the number of health risks people have? Are you reducing absenteeism? Are you reducing work accidents on the job? Are you increasing satisfaction among your employees? Are you helping recruitment and retention? So if you look at all these different categories, again, you can apply this not just for centers, but for any health benefit that the employer offers. But many of these, you can gather data within a fairly short period of time, 12 months or less, that you can then demonstrate the impact the center is having. Some of these will take longer. Some could take 2 to 3 years to determine if you're saving costs. But many of these others you can gather before. Now, we've created a guidebook for measuring the performance of worksite centers that covers all the VOI areas and provides samples of metrics and approaches you can take. And this is free to any member. So if you're a member of our organization, you just go to our website and get a copy of it or contact our office. If you're not a member, we do make it available for sale for people. But this covers everything that I'll be talking about today. So measurement can only be done if you've got the right criteria and the right time period. So your ability to drill down into certain areas and to measure certain areas really depends on how long you've had the center, what are the nature of the services you've got, how deep do you want to drill down? Do you want to know how many people are on generic drugs or how many people are on statins? Do you have that kind of data? Does the clinic manager you're contracting with have the tools and understanding to collect the data you want? This is a question you should ask even during the RFP. And again, do they have access to your claims data? So a key part of measurement is making sure you and the manager of your center have the same understanding of what you're measuring. These are the key measurement areas in a VOI approach that most of our members are using. So financial, clinical improvements, program participation, utilization of the center, patient satisfaction, behavioral change. As you can see, there's different ways to look at it. You have to decide what's most important because if you may not have the staff, you may not have the data, you may not have the technology to collect in all of these areas. So you have to pick out the ones most important for you. So again, our most recent survey, the patient satisfaction was the number one measure because word of mouth will either make or kill your center. So if you've got patient satisfaction, that shows people are getting the care they want, they like the providers, they're getting in when they need to get. That will drive it. And so you want to know what people's satisfaction is. And then these other areas are all things you want to take a look at as you look at VOI. Now, you've got to, as I said before, get some agreement between the managers. So what should be in the numerator and what should be in the denominator really depends. Are you looking at the number of people who go to the center or the percent of people who go to the center? Are you want to measure their total population or just those who are covered? You want to look at just those who are eligible for the centers or everybody who actually uses it? You know, is a patient someone who comes in once a year or comes has all their visits there? So you've got to start when you're working with a vendor or a health provider to really decide what those definitions are, because otherwise you're going to get different kinds of reports that are not going to be reflective of what you're looking at. Right? How do you measure utilization? Well, first you got to decide what groups you want to measure. Do you want to look at all the population? You want to look at just people who are eligible for the center? You want to look at everybody who's using the center? People who are using different visits? You've got to decide what groups you're going to survey, and then you're going to decide whether your utilization rate is what you want and where you want it to be. And over time, you want to use the same group to measure that utilization and that change. So these are the major areas of utilization that we find our members taking advantage of. Visits for any type of service to the center is really the number one. Over 96% participate. Number of visits who are coming into the center. Those even for non-providers who may be coming in for vaccinations or for prescriptions or things like that. So there's different ways, again, that you can take a look at this and you want to decide. Also, same thing going for patient satisfaction. There's a difference between patient experience and patient satisfaction, and both of these really do influence whether people are satisfied or not. So patient experience is generally what happened while they were at the center. Patient satisfaction is often their expectations and how they view the care that they provided. So this is all impacted by the enrollment process, the confidentiality, providers, wait times. These are things that you might want to just survey people on. Or if you just want to look at your registration process or your quality of the providers. You have to, again, you have to decide and then have metrics to do that. And you've got to look at it in multiple ways. You should be collecting not just surveys, but you might want to collect information from people on their experience immediately after they visited. Most of our members use the NPS or the Net Promotion Score, a scale of 1 to 10, and people should be rating, would you recommend this clinic or this center to your friends or peers? And they rate it 1 to 10, with 10 being highest. And you should be getting nines and tens. That's what you're shooting for. It's often tied into the performance guarantees that employers have with their health providers and clinic vendors. Because if the center, again, it's not successful in attracting people and being and satisfying their needs, people are not going to be using it. You've wasted all those benefit funds. You also want to survey your providers. Are they happy? Are they sitting around? Do they feel they have certain needs? And you really want to check other opportunities. People may list you on health grades, for example. They may want to be rating providers there. So you might want to look at it from a variety of perspectives. And again, here's a list of issues that impact someone's view of whether they were satisfied or the center met their needs or not. And so you're going to want to take a drill down as you look at these different ways of going about it. And these are also ways you can enhance the visibility of the center as well as how people take advantage of it. You should be addressing the population. If you've got multicultural people, if you've got people who have to come from far distances, if you're dealing with spouses or children, whatever the case may be, you want to make sure the center is meeting their needs if in fact that's the group you want to attract, and you want to make sure that the engagement that the providers are having, that people are having with the reception, the registration process is all being done easy way. So these are the most frequently designed metrics used to look at the different elements, whether the over and net provider score, satisfaction with providers, with the care, etc. You want to look at these because you can't improve unless you can evaluate what's happening. If you want to talk about engagement, engagement being people not just sign up, but actually complete programs. Uh, are they participating? Are they even aware of the programs? We had one time a meeting with, I had a user group of Blue Cross Blue Shield employers meeting with the Blues. And we asked them, how are you treating our diabetes people? And the Blues would say, well, our studies show that we have 85% of your diabetics registered. And then we asked, well, what percent completed your program? And they said, well, about 20%. So we were able to really impact and get them to change the programs because we asked them to measure and report on, and then we could respond to the things they were doing. So, all right, financially, clearly you want to look at the medical and the pharmacy claims. But when you're working again with a vendor, you want to make sure, again, the definitions are right. You want a methodology that looks at these costs, that looks at the expenses. You want an aggregation of the medical and the pharmacy, the absent manager, workers' comp claim. You want to make sure that it's accurately being reported, and you want to compare the experience of the populations treated at the center versus those non-users. And because if you just use those who are using it, then you're not going to get the full picture. Again, employer want to look at the total population health, and so you want to see what the impact of the center is going to be. Now, in dealing and trying to get support from the C-suite and CFO, they're looking for hard data. We used to report on presenteeism, which was the number of people who would come to work 9 to 5, but weren't really functional because of mental or physical problems. Well, the CFO can't put her hands around that. So these are the areas that you can talk about, that you can measure or ask your vendor to measure. And sometimes you're going to need other parts of the employer's administration to help collect this information. But this will help you then give hard data on money spent or money saved, whether it's getting new resources or reducing costs, etc. These are other key areas that you could look at, particularly from the risk management side, that can really make a difference and help explain what impact the center is having. For example, we find that when people leave work to see a doctor, pick up a drug, get a medical device, they're gone 3 to 4 hours. They go home, they feed the dog, they may not come back to work. Well, that has a huge impact on productivity, particularly if they're part of a team or a key part that makes that team function. So you want to be able to offer services and make sure people are coming for services at the work site so that they don't have to leave. You also want to reduce, again, industries on the job. Employers spend millions of dollars on safety programs. But if you don't spend a similar amount on wellness and health programs, those people who are on medications that may make them drowsy or they're not feeling well, they're going to have accidents, they're going to have incidents. And so there has to be a link and an understanding with the employer. But if you don't have the data, you can't measure and show this, you're not going to be able to do that. Reporting is key. Now, this is a busy chart. But it gives you an idea on the left side of the different kinds of areas that could be reported. And the colors show how frequently they should be reported. So utilization is key. So you want to do that more frequently. Satisfaction is key. You're going to want to do that more frequently. Some of the other areas will take longer. But you still need to report at some level in order to get this accomplished. So finally, on results. When we ask our members, are your centers meeting your objectives? They've been able to measure it. And the way this color coded, you've got by different size of employers in these key areas of VOI, and particularly on health and wellness. And you can see most of them were able to report over 50% improvement or satisfaction in these areas. And also when you look at meeting the ROI, meeting the financial issues, what are most important. And again, so there's opportunities here. It all depends on the employer. Do you have the data? How long have you been active? Can you have data that will support you? For example, you could just collect data on an emergency room use before and after the center to identify that works. And this is the most recent survey that we did with Alliant Health Services last year, showing return on investment. And these were employers that were actually able to show, in fact, that the center was making a difference. And that will again help them maintain the center and get the resources they need for either new centers or to expand upon it. So at the end of the day, you want to decide what are the objectives for your center. And then you want to plan to measure them. You want to create approaches that you need. You want to make sure you get agreement on the numerators and denominators, the definitions with your clinic manager. You want to make sure the vendor has an understanding of your objectives. You know, and unfortunately, in many cases, a hospital who's helping an employer, their objectives may be different. Their objectives may be let's fill beds. The employer is saying let's not have unnecessary hospitalization. So we want to come together. We want to get some agreement on the approach and then be able to measure that. You want to use VOI whenever possible. You want to put in your performance guarantees with the clinic manager, the areas you want measured, and you want to set the levels that you want it measured by. You want to set the expectations of senior management. Some things you're not going to be able to do or accomplish right away. It may take time. So you want to make sure, better be conservative in your expectations. You want to use the results for supporting your resources. You want to make changes as needed and monitor what's going on. So that's like a fire hose of information for you. And at this point, what I'd like to do, as I said, this has been recorded. You'll get copies of all of this information. What I want to do now is just kind of go around the table and get your perspectives and thoughts that you could share with the group about your own experiences. And I'll just call you out by name. And again, when I give call your name, you should just give your title, your organization, and your thoughts about what's going on. So Beth McClure from Center Care, why don't you start out, please?
Hi, good morning. I'm Beth McIver with Center Care, which is part of Med Center Health, which is a hospital system in South Central Kentucky. I mean, I have a couple other folks here with me that are part of my team, Julia Tabor and John Mark Phone. So we're all on the same team. But we offer a variety of worksite and industry-based programs, and we're still within the first year of on-site clinic management within industries and measuring the performance of the on-site clinic providers. So I'm really here today just excited to learn more about what others are doing, different approaches we can take, and different measurements, and just to see what we can implement into our program.
Okay. Any questions you have, Beth, at this point?
I don't not at this point, Julia. And not to skip around. I know you've got your order of people, but my other team members may have questions when you get to them.
Okay, fair enough. Fair enough.
Yeah,
All right. Well, let's start with.
yeah.
Go ahead.
This is John Mark with Med Center Health. I work with Beth and Julia. So, what we've tried to do is, well, or what we are doing is, we have a quality incentive program for the employer-based clinic that we manage, and they have this employer has two locations, plants in our area. And so the quality and productivity program, which is what we call it, it has measures that include, from a productivity standpoint, just the visits, and we look at, okay, who are the unique patients, how often are they coming. We have targets for that, and the baseline on that target was the previous history of that employer. Then from a quality standpoint, to come out of the gate, because we just didn't have very much data. So our basic question, or well, our basic goal at first was to gather certain basic information about the patients as they come in, so that we had a baseline so that we can then create metrics to move the needle, if you will, on whether it be BMI or diabetes. And so that's what we are trying to do. One of the frustrations that we have had is getting the employers that we contract with us for near site programs and for on site to give us their health plan data. And I just feel like it's a real missed opportunity, and we just struggle to get that information. Um, and because we do population health on our own employee population, and we see the difference that it makes. And so it's just a missed opportunity. It's kind of that's a frustration that we have, and maybe one day we'll get people to convince their Anthem or United to give us the information. But that's we have success, but we have some struggles. Thank you.
Understood. Thank you, John. Melanie Small, Melanie, your thoughts and comments, experiences?
Thank you. Well, very similar. I think we're probably all on this call for the same reason, where it's challenging to show the ROI. And to your point, so I work in Maine. We are a physician-owned practice, and then we have a couple of on-site clinics for a couple of large employers in our area. And so we're always being asked and always trying to figure out the ROI. So that's something. And on the call with me is Lillian Shields and Emily Biro, who are both from my team as well. So they may have more questions and comments, but I agree with John that it can be frustrating when you can't get the data from the claims side of the house. And you're never quite sure if it's because they don't have it or because there's some other underlying reason that they're not providing that information.
Well, I mean, when you ask them directly, what do they say?
They'll give you enough to say, okay, we're giving you information, but then you have to ask about 30 follow-up questions because the data it's not comparing apples to apples. And so you have to keep it, well, what about this? Well, what about this? And what about, so yeah, so I agree. It's a challenge.
Yeah,
Well,
I would, what we get and what we see is, and so part of what we do is we have a clinically integrated network. We contract with payers for population health, ACO and whatnot. And employers, I've been shocked at the high level summary fashion of detail that some of them get from their large payers. And Larry, you kind of spoke to that earlier when you talked about your experience previously with some of the detail. So in some cases, the data we get is just very high level. It's not detailed enough to give a doctor or an APRN enough information to say, okay, what do we do different tomorrow? And then we've had some employers just simply say, well, they want to charge us to get that data and get that report, and we don't want to spend the money.
understood. Well, at some point after this session, if any of you would like to send me a description of what you would want employers to provide, maybe it's something our organization could promote to employers so that you have the data you want. Christy Patterson, comments, questions, experiences? Christy?
Yeah, we provide services to a pool of employers that are school districts in our county here in Northern California. We've had our clinic since 2014 and took over self-administration in 2023. Unfortunately, we aren't able to get clinical data from our underlying medical program, so that's an unfortunate disconnect, but we rely heavily on patient survey data as far as the value of it to them. We spend a lot of time looking at that. And our providers are hyper engaged in the program itself and really want to make it work. So they're really diligent on ensuring that they're compliant with the underlying medical program and trying to minimize costs for those patients on out-of-pocket services when they have to refer out. So,
Okay, well, thank you for joining. Emily Burrow, your thoughts, comments, questions?
Hello. As Melanie Small said, I work with her and Lillian Shields as part of Intermed up in Maine. I manage one of the on-site employee clinics. And I think for me, the challenge is that we are one piece of the larger health and well-being puzzle at the employer where we are contracted. So most of those point solutions and other vendors report on ROI. And so the expectation is for us to report on the ROI too. And that I think for me is how to help shift that thinking from the ROI to the VOI and have it be as valuable information as the ROI is reported by the other point solutions.
Absolutely. Yeah, we're behind you 100%. Michelle Balas. Michelle, your thoughts, comments, questions?
Hi, good morning, everybody. I'm Michelle Bamsida. I'm actually a physician. I'm transitioning from occupational medicine going to the on-site well-being space. I've attended today just to kind of get an overview, try to understand what on-site well-being can offer for our healthcare system. We have at least, if I'm not mistaken, 5 on-site well-being centers currently. I'm trying to understand how they work and how I can help, affirm the medical program that we have. No questions for right now. Thank you.
Okay, thanks for joining us. Daryl Zemek, is it Daryl? Your comments, questions, experiences? Take yourself off mute. There you go. Go ahead. Still can't hear you. Can't hear you, Daryl. We cannot hear you, Daryl. Nope. You got your microphone on? Speak into the computer. Put the volume up, maybe. Well, if you want to send us your comments in the chat, I'll read them for everyone, and we can go from there if you have any questions. All right, while Daryl's working on that, Lillian Shields, your thoughts, comments, experiences?
Oh, thank you, Larry. I'm Lillian Shields, and I have the terrible light. Oh, there we go. Terrible
There we
lighting.
go.
I am the strategy manager of community partnerships for Intermed. My first question was going to be, how are you all getting raw claims data? We're only getting metrics that may or may not be usable, and the denominator may or may not be clear. So as we've had this discussion, it's been helpful to hear that others are receiving sort of metrics from payers opposed to raw claims data. And one of the things we're experiencing in Maine is that we work for international and national organizations, but we are a Maine-based company. And so to Emily's point, to really be able to carve out what our ROI is when it's somewhat diluted or hidden among other claims that have nothing to do with Maine has been really challenging. So claims are difficult to get, and then to slice the data even more to this cohort of people we experience has been particularly challenging. So trying to figure out how we fit into the ecosystem of these companies is an interesting challenge that if folks have thoughts on, I would welcome.
Great, thank you. Anybody have a comment or suggestion? Common frustration, clearly.
I got a
Right.
question.
Go
So
ahead.
in your situation, Lillian, how are you guys, what's the economic model for your clinic? Are you guys billing out to the health plan, or is the employer paying you for just basically salary and benefits for the staff? Are they paying you a PM? I mean, kind of, how does the activity that you're doing, is it hitting the health plan?
Great question. No, it's mostly not hitting the health plan. Most of it is direct contracted, particularly the clinic that Emily was talking about. So we do have a data feed. So we send all of our information to the payer, and we make sure that we utilize accurate CPT coding and diagnosis we follow as if we were going to bill, which has been helpful for us when we talk about claims avoidance, because we actually can compare something that didn't go through the health plan that's a 99213 to something that did go to the health plan as a 99213. So that's been helpful. It just has been challenging when the whole book of business is much larger than our slice of the world. Even though it's the majority, it's still really hard to parse out. And when the data gets squishy, you lose credibility. And so it's been hard to create data without a bunch of caveats.
Yeah. Thanks
Thank
very
you.
much.
Yeah, of
Thank
course.
you.
Anytime. I'd love to talk more if you're ever interested.
Yeah. All right, Daryl Zarozak, you back with us? Daryl, comments, questions? Okay, we're going to have to move on from Daryl. Sue Goodling, good, Sue, welcome. You're on mute, Sue.
Thank
Take a second.
you. Oh,
Any
I didn't
comments
have
or
a question.
questions?
No, I did
Oh,
not.
okay.
Very interesting though, but thank you.
Okay. Nicole Strauss, Nicole, any comments or questions?
No comments or questions at this point. I actually work with Christy Patterson at our health center here in Northern California. So she touched on a lot of the great things that, our providers are doing, specifically, especially with the point solutions through our health plan. I feel like our providers are our biggest champions to direct our members to those free and low cost services outside of our center that can really help them boost their health and overall engagement in the programs that are offered to them. So,
Great, thank you. All right, we've got time left, but if nobody's got any questions or suggestions, again, I would ask all of you on the phone, send me a note and say, what do you need from employers to be able to do metrics, to be able to measure, to be able to report? And then I'll make sure I put that in our newsletter, and maybe we'll just do another webinar and we'll try to have employers say why they're not giving you the information or what the issues are. I know employer fee, some plans do require payment for data feeds. Others do not. Some plans will allow a certain number of feeds per year. And we know that. And sometimes it's just depending on the employer. If Boeing wants data feeds, they get data feeds. If Joe's Print Shop wants data feeds, they may not get them. It depends on the plan, its perspective, and the account manager as well. But it's clearly something we think is important. And as I showed in my earlier slide, many employers don't integrate their data and they don't even get that data. They don't share that with their partner. So it is a constant challenge, and you can't do your work and they can't get the results they want or the reports they want if they don't provide that information. And I really don't think it's a confidentiality issue. There must be more. I don't know. Sometimes maybe there's more of an administrative burden or reports that have to be filled out. But again, love to have your input so that I can direct this to the employers and the purchasers and get their response. Well, with that, if there's no other questions, again, thank you all so much for taking time on early Monday. Stay warm if you can, or come out by me in Phoenix where it's going to be 80 degrees today. And come to our next program, and we hope to see you at the annual forum in April. So thanks, everyone. You'll get a copy of the link following this program. Have a good day. Take care. Bye-bye.